Hey everybody, it's Dr. Tyler at Sioux Center Chiropractic, and today I got Maddie here. She works for us and handles a lot of our admin and chiropractic assistant work, and she's been having some upper back and neck pain as well as some lower back SI joint pain. So we're going to do an evaluation on her real quick, and then we'll go ahead and start treating her and see if we can make her feel better the rest of the day. Sound good?
Perfect.
All right, I'm going to have you stand over here and we'll just go through your top tier SFMA. So yep, right there facing me, feet facing me. And then let's just start with your head and neck. Look up as high as you can and down as far as you can. Straight ahead. Now I want you to turn your chin to the right as far as you can and left as far as you can. Any discomfort any of those directions?
It's a little tight.
Yeah, and is it mostly the right side you're getting it?
Yep.
Okay. I'm gonna have you turn around now, and we'll check your shoulders. I wanna have you take your right hand, reach behind your head and touch your left shoulder. And then we'll do the other side. Any discomfort with those?
No.
And then we'll go underneath and touch the bottom of the opposite shoulder. So reach behind your back, yep. And the other way. And do the left again. Any discomfort either way?
No.
So turn your head to the left, and I want you to twist your whole upper body back like you're looking at me. So go ahead. Any pain there?
No.
It's pretty good going all the way in rotation. Let's try the other side. Anything there?
No.
Okay. Good. Now I want you to just turn to the right just slightly, so face your body this way, and then try to look down at your toes and touch your toes. Is that painful anywhere? Where? Or in the hammies?
Yeah.
Anything in the lower back?
No.
Now I want you to reach above your head, look up at your hands, and arch backwards. Any pain there?
No.
No? Okay. Good. Now we're gonna go ahead and face me a little more, and we'll do your squat. I'm gonna have your feet together. Go ahead and squat as low as you can. One more. Any pain with that?
No.
No? Okay. Have a seat right here. We'll do a little motion palpation on Madison, and we're just gonna assess the joints. We're gonna challenge the joint, and a healthy joint should be springy. If it's not moving well, you're gonna feel a good hard block at the end, and it's usually pretty tender. Any of that tender? Or not too bad on the right? And then here. Any of that? That isn't moving very well on the left. Is that tender or not really? Yeah? Is that mainly where you've been feeling it? Hands behind your head, bring your elbows together, and then I'm gonna have you just rest your elbows on my forearm and just let me kind of challenge in the upper back. That's sore.
Mm-hmm.
Okay, relax, let your arms hang. And we're just gonna feel into the cervical spine. A little sore in there. Have you lay on your back. We're going to check a few things out in the hips, and we're just going to start by bringing the right knee all the way up. Any pain there in the back or hip? And then how about there? How about there? Nothing? Good. All right, then we'll go up. Any pain there? There? Or there? No? Good. All right. Let's go on your stomach, and I'm just going to assess hip extension. Any of that uncomfortable? Not too bad. That side's looser though.
Yeah.
Did you have pain with that one? Or not really?
On the left?
Yeah. Do you feel like it's a little more stiff?
Yeah.
So sometimes when we're working on SI joints, the painful side on a patient might be actually moving fairly well, might be trying to do a little bit too much. The non-painful side, it can often be the restricted side. And I always like the analogy, if I had a husband and wife and they were going to go out and clean the garage, and the husband sat down in a lazy chair and cracked open a beer and the wife did all the work, who's going to be mad at the end of that 3 or 4 hours? Probably the wife that was doing all the work. So in her case, if her pain's more in that right SI joint that's trying to overcompensate for a lack of movement on the left, that might be why this one's angry. So it's important that we aren't just chasing pain when we're assessing a patient. We have to look at how the function of that person is globally so that we're doing the appropriate treatment and not just chasing our tail by chasing pain. So in Madison, I'm noticing more restriction on that left SI joint, so we're gonna adjust that, and then we'll work our way up. She had some restriction in the lumbar spine, thoracics, upper thoracics, and then into the cervical spine. So we're gonna start with just doing a little active release. I'm gonna try to get her hip flexors. She was a little tighter on that left side when I assessed that, so we're gonna do a little psoas stretch first. I'm gonna have you lay on your right side. And Maddie, what you're gonna do is stay on that right shoulder, and I'm just gonna be in the front of the hip flexor. You're gonna straighten this leg and bring it back all the way, and then you're gonna reach over your head with this arm so we can get that to release. So I'm gonna be right in between here and your belly button. Bring the leg back first, all the way. Keep coming back, and then reach, and then go forward, all the way up, and we'll do that again. We'll do about 2 or 3 more of those, okay? Forward, and back. Feeling that? Okay, now I'm just gonna have you do the leg only. I'm gonna be on a muscle right inside the hip here. Now just your leg. This is called the iliacus muscle. It sits right next to the psoas muscle, part of the hip flexor group. One more. I'm just doing a little active release over this. Okay? Okay. And I'm gonna work just right around that SI joint. I'm gonna have you bring this leg forward and then reach back with that top arm. And I'm gonna have you just slightly push forward into my elbow, and then just bring that leg up a little more and push into my elbow. Feel that under my thumb? Good. I'm gonna bring the leg back, and then bring the leg forward again and wait until the end and then push. Feel like I'm on it? We'll do one more. There you go. Good. All right, cool. While I got you there, I'm gonna go ahead and bend this knee up. So right here, bring your hip forward towards me, and then just slide your head onto the paper right there. Okay, I'm gonna lower this a little bit, and then we're gonna adjust that SI joint and the lumbar spine. So just take a deep breath in for me, Maddie. All the way in, all the way out. Good, then we'll go the other way. Okay. And we'll go all the way in, all the way out. Good, okay. All right, come back up, and then we'll slide down to the end. I'm gonna work a little bit up here, and I'm just gonna start by reaching down and away, look down and away, back up, down and away, look down and away, back up, and relax the arm. And work the neck a little bit here. Pretty tender. Here, and we'll go down into your left. Good. Good. Better or worse on this side?
Better.
The neck. We're gonna get the thoracic spine moving a little more. Maddie, I'm gonna have you lay on your back all the way. And we're just gonna go here to here. And when I tell you, go ahead and take a deep breath in and let it out, okay? All the way in and out. Good. One more. All right, come on up. And then lay on your back. We're gonna do a little more active release on that neck and trap area. Doing all right so far?
Yes.
All right, just let your head relax. Let me do all the work. It's really tight going into the suboccipital area, which is right at the going into the base of the skull. That's a common area that we'll see patients come in with if they're on computers a lot, phones, doing anything that involves looking down. Madison's on answering phone, she's inputting patient paperwork into the computer, and she does a good amount of laser therapy on her patients too, so it's easy for that head to get in that forward position, which really tightens up these muscles. So this can lead to headaches on patients if it goes untreated long enough. We try to pair this with some exercise to really start to strengthen that after we get the mobility back. Today we're focusing on the mobility with her. And then another muscle group we'll find that is overactive on patients is that upper trapezius. So I'm gonna just do a little release over this. So we're gonna bring her head over to the left and over to the right. Feel that?
Yeah.
Okay. Left again. Opposite side. All right. Got our segment here that we're going to adjust first. So Maddie, just let your head relax. I'll do all the work. And just kind of wiggle your toes. Good. Other one. Yeah. Feel okay?
Yep.
Okay. All right, come on up and let's retest everything. So I'll have you stand here again and go ahead and face this way, and let's go looking straight ahead. I want you to go ahead and look up at the ceiling first, all the way up, all the way down, straight. Turn your head left and right. Okay, go ahead and turn around, and then we'll do the shoulder moves. So we'll go over the head, touch the opposite shoulder, do each arm. Good. Left. Good.
Nearest.
Not near as tight.
No.
How about going underneath now? Other one. Good. And then I want you to rotate left and right. So turn all the way back, right and left. Good. Other one. Good. And now just face me, and then feet together. Go ahead and touch your toes. How's that feel in the low back?
Yeah, better.
Then arms up, arch back. Good. And then do your squat. All the way down. How's that feel?
Good.
Good? All right. So she should be ready to go for the rest of her shift today. And thanks for watching. And we'll look forward to showing you some more about what we do here.